All right, so we've given it a few minutes. I'm going to go get started. Good morning, everyone. The agenda for this morning's press conference is going to be the following. I'm going to give you some up-to-date information as far as the COVID-19 virus as we're seeing it in East Parish community. There will be a time for question and answers at the end, which will hopefully get to all your questions here on the live feed. So first, I'd like to start with giving you an update. Before I do that, I would like everybody to remember and understand currently right now we're dealing with the loss of life in our community. And while the topic on everyone's mind is this pandemic, what you have to also remember, there are people losing their lives every day for other reasons, and we're still investigating those deaths. Whether it be natural or even unnatural causes of death, people are still losing their life in our community. So along with the folks that have died as a result of the COVID virus, I want you to remember the other individuals in the community as well. Pray for them and their families and keep them in your thoughts and prayers. By now, we probably all personally know somebody who has been affected by this pandemic. Certainly, it might even be a neighbor or a close friend or relative who has either been diagnosed having COVID virus or is showing symptoms of and being quarantined as a result. So I think it is really hitting home for a lot of individuals currently. So keep all those people in your prayers. So the update on numbers, I updated the parish earlier today on the number of deaths here in East Parish. The total number of deaths that I've investigated here in East Parish is 12. That includes 11 East Parish residents and one who is a resident of Mississippi. Although the state will count that, not count that number when you look at it on their reporting mechanism, they're only counting Louisiana residents. As the coroner of East Parish, I'm just jurisdictionally responsible for investigating death, so I will continue to count that in my numbers. And of course, if there are any other out-of-state deaths that I'm responsible for investigating, I will count those as well. All of the deaths that we have investigated, every individual has had significant comorbidities. So oftentimes people look at the age and think somebody that young has succumbed and had an issue with this virus. Understand, everybody we've investigated have had comorbidities. And when I say comorbidities, the things I'm talking about are people having high blood pressure, diabetes, COPD, or chronic obstructive pulmonary disease, lung disease, morbid obesity, and certainly age has played a factor. And I think you've heard about that in a lot of the media outlets. We're talking about our high-risk population, the vulnerable population being our elderly folks. And we're going to get to more about that in just a second. The second thing I want to talk about is your personal mental health and your personal health. During this time, you really have to take an opportunity to take care of yourself. You should go for a walk outside, enjoy the beautiful weather. Before you know it, it'll be summertime and be 100 degrees and not very comfortable outside. So take this opportunity, especially that most of the community is now staying at home, to get out in your backyard or your front yard and soak up some of the sun's rays to help with yourself. Exercise. Don't get involved into too much of a sedentary lifestyle where you sleep all day. But go for walks and participate in an exercise regimen at home. While doing this, make sure you still practice social distancing. It's very important that we continue to do that. Oftentimes you'll see people that choose to go out and exercise, which is a good thing, but there's a group of 20 of them doing it together. Probably not a good thing. At least separate yourself with some distance so that you can make sure that you're practicing good social distancing. Not only needing to take care of yourself physically, take care of yourself mentally. Read a book, exercise your brain. These are all good things to do to handle your personal mental health while we're stuck inside and quarantining ourselves and in our isolation. Also take an opportunity to do something maybe you thought you never really had time to do, and now you do have time to do that. Since we're all working from home or staying at home, and we have our day-to-day routine, but also consider the fact that you have an opportunity to do those things that maybe you've been putting off for some time. When it comes to mental health, I want you to take care of other people too. The way we're going to help save lives is to identify those folks in our community that are high risk and make sure that we keep them isolated, but we bring them things they need. right? We call them on the phone. We make sure they have the food they need. These are the individuals that it would be worse if they actually went somewhere. So if you've got a family member, a friend, a neighbor, check on them. Give them a ring. If there's anything you could do for them, go to the grocery store, get some food, bring it to them. If you're unable to do that or you need assistance with that, there's a 211 number you can call to get that individual the food or help that they need. And visit with them. It's good for their mental health as well. We had a recent question from a concerned community person that wanted to know that during the crisis, have we seen an increase or an uptick in people committing suicide or overdosing? And the answer is no. We have not seen an increase as a result of that. I would even say, as a matter of fact, it might be even the opposite. Life has seemed to slow down a little bit for some of us now that we're no longer having to drive to work and what we call the hustle and bustle of life. And families are spending a lot more time together. So I think that's probably pretty good for our soul as we come together during this crisis. Now what I'll do is I'm going to try to take questions. As the feed goes up, sometimes the question gets missed. I apologize for that. I'm reading as fast as I can. But understand this. If we miss your question, we'll go back after the live feed and do our best to make sure everybody's question on the live feed was answered. So I'll attempt now to try to answer any questions. So there's a question that says, so if you've had the virus, can you get the virus again? Likely, we believe that if you do develop the virus, you're going to develop immunity to it. It's not to say that you can't get an alternative virus in the future, but having the virus should develop immunity in your system. And of course, we'll know that as this, how good that immunity is as this pandemic progresses. But for all current medical knowledge, we know that you should develop immunity as it comes. I'm not sure if the government's the question is the governor planning on extending the order? I'm not sure. I don't have any direct knowledge of that. However, I do know federally they have extended some quarantine orders. So I would feel that most states probably are going to fall in line with that. This is a day-to-day process, just like you've heard me reporting about the numbers on a fairly regular basis. I think the government is taking it step by step. The one thing we don't want to do is release everybody from isolation too quickly, because then we might find ourselves in a precarious situation and have to go back into isolation. So it's probably best that we take it slowly. Whether that be 1 day at a time, 1 week at a time, but I think the governor and the government certainly are going to look at that and make the best decision for us as a community. So over the weekend, the question is how many deaths did we have since last Friday? We had an increase in 3 East Baton Rouge Parish residents' deaths. To bring us to a total of 12. That's 11 EBR residents, 1 Mississippi resident. So that's our current number. This number is very fluid. It changes very rapidly. And so we will potentially be sending out press releases almost daily to update the community as this occurs. Like I said in the beginning, please remember these families who are struggling with this at this time. Keep them in your thoughts and prayers. Do I know if there are multiple strains of the virus? I do not know that. In essence, all we've been briefed on is COVID-19. You bring up an interesting point. Is there the possibility that this virus can mutate into a different strain, an alternative strain? Yes, that is absolutely possible. But I'm sure the folks at the CDC are monitoring that very closely. And we know this because we've seen this in other viral infections that have plagued the world before. So the question is what is the time for the test results? So it depends on the laboratory. Certainly, a lot of labs did not conduct this testing on a routine basis, and they've had to figure out a way in order to get their labs up and running to handle such a volume. Typically, it's 2 to 5 days, and that's certainly as more of these laboratories come online with the ability to test. We have not seen the development of a rapid test yet, much like in the flu, for example. You can go and get tested for the flu with what's called a rapid flu test, which usually takes about 20 to 30 minutes. Eventually, I imagine that test will become available. I'm sure they're working on it right now, and when it does, it'll allow us to test a lot of people very rapidly. But for now, we're still having to wait that turnaround time. If you have suspected symptoms of the coronavirus, certainly while you're waiting on your test, it's very important that you isolate yourself, that you quarantine yourself to prevent the spread if in fact you have coronavirus. Those symptoms that we're worried about are fever, cough, and shortness of breath are the big three. So initially, the question is why are hospitals not COVID testing if positive for flu? Initially, the thought process was that if there was no incidence of co-infection, meaning if you had one, you didn't have the other. That was very early on in this pandemic. Now we know that it is possible to have both, and so what they're doing to triage who gets tested has really to do with who needs to be emergently tested. Obviously, if you have symptoms that are progressed enough to need mechanical ventilation on a ventilator, those people are being tested, obviously, quickly, even though the results may take a few days. People that come in with symptoms but are maintaining decent vital signs are typically sent home for quarantine and maybe outpatient testing. And so that's kind of how we're triaging who gets the test. As more tests become available, you'll probably see more people get tested on a very regular basis. But that'll just be with the passage of time. Gatherings of 10 or more people, how do I report that? You would report that to the police. Certainly call the East Baton Rouge Sheriff's Office or the Baton Rouge City Police if you wish to report people of more than gathering of more than 10 people. Certainly it's not a smart thing to do. Isolation is the key here to preventing the spread of the virus. But I would call the folks at the police department and maybe they can assist with that. The question is can COVID be detected by any abnormalities in a blood specimen? When do you anticipate our area's numbers to peak? So the first part of the question is a blood specimen. No, we are using nasopharyngeal swabs, a swab that actually goes into the nose and takes a sample from what we call the posterior pharynx, where basically the nose and the back of the throat. That is the most sensitive way to detect the virus and or use that material that is swabbed in the machines that test for the virus. I am not sure when we anticipate the area's numbers to peak. We will have to, it really is a wait and see. We have seen, as far as what I do jurisdictionally with death, that it's been a few deaths every day. And so what will be telltale is if that starts to slow down. If that starts to slow down, then we know that the individuals that are sick, even the ones that are critically sick, are getting the things that they need as a result in the hospital. But we'll have to, it really is a wait and see scenario. If there are any other questions, we'll still try to answer them, but we're going to be signing off here shortly. So I'll just give it a few seconds to see if we have anybody left. All right. Well, seeing no more questions, and if we missed your question, I apologize. We will definitely go back. We will definitely go back and try to answer it online. So, Jay, I just saw you pop up that you had one above we didn't get to. I apologize. we'll get online right after this is over with, and we'll make sure we get your question answered. The last thing I want everybody to remind you of is today is National Doctors Day. So I would like you all, if you have an opportunity to email, call, send a message, thank one of my colleagues, the physicians that are out there in the community who are today's heroes, along with the other healthcare providers, nurses, people that are working in the hospitals, people our first responder community, the EMS community, and send them a message of thanks. They're the ones that are out there that are putting their lives at risk and working hard to save lives in this community. So please pray for them and pray for their families, and everybody stay safe. Thank you.